the world marked February 4 every year as World Cancer Day to reduce the rate or eliminate the disease through creating awareness, a non-governmental organization, the Pink Africa Foundation, and our global partners, in collaboration with Association of Resident Doctors, University of Calabar Teaching Hospital, has organized free cancer screening for personnel of the Nigerian police force and their families. The screening include breast, cervical, liver, and prostate cancer tests, as well as HIV/AIDS checks to commemorate the Cancer Day in Calabar. The President, Association of Resident Doctors, University of Calabar Teaching Hospital, Dr. Ukpo John, and a consultant community health physician, University of Calabar Teaching Hospital, Dr. Joy Benson, hinted that the World Cancer Day is a day set aside globally to create awareness on cancer diseases, with this year's theme closing the care gap by heightening the level of awareness of the existence of cancer. They noted that cancer is a lifelong illness that can be prevented through interventions, sensitization of the people, screening, and prompt treatment.
It's a day that is set aside globally to create awareness of cancer. The theme for 2022 version of World Cancer Day is closing the care gap. And how do we intend to close the care gap? It's by, number one, heightening the level of awareness of the existence of cancer in the general public. Two, trying to bring on board measures to curtail or curb the stigmata.
So we're trying to close the care gap by reaching out to the Nigerian police force. Now, why the Nigerian police force? Nigerian police force, because we know that they actually ensure peace and security in the state, and we know that their healthcare seeking behavior is generally poor.
On behalf of the Pink Africa Foundation, the Secretary General, Mrs. Geda Etefia, and Project Manager, Mr. Victor Ukpo, said World Cancer Day is a global event aimed at preventing millions of deaths each year by raising awareness about cancer and encouraging governments and individuals across the world to take action against the disease. They further advise people to come out for screening, as early detection can save lives, as cancer is not a death sentence.
We are trying to bring it back together, make people understand that cancer also kills as much as COVID does. So we can actually take care of both on the same level. Because of COVID, cancer has actually been neglected because COVID kills faster than cancer does. So that is why we are asking that people come out and get screened, so that the earlier you find out, the earlier something gets done about it.
So we're trying to make sure that our people are aware that there is a need for these things. It's no longer a white man's disease, and people have to be aware to check themselves often.
The officer in charge of Police Medical Services, Cross River State Command, CSP Jenkins Okanga, and one of the beneficiaries thanked the Pink Africa Foundation, stressing that raising awareness on cancer prevention has become a prominent goal.
Generally, we Africans don't value our health. It's not just the police, it's an individual thing. So if you say police, not police, because there's a time for everything. Even in police, you have the right to go to hospital for checkup. Just book hospital, and you're allowed. The authority knows about this. Nobody has said, I'm sick, that will not have the privilege to take care of himself or herself.
And they've helped a lot of females, because if we had this awareness, I think the things that are happening to most of our females, we won't be losing our sisters and mothers to cervical cancer. So I would say thank you to them, and we hope to be seeing more of this.
Close the care gap. Close the care gap. Close the care gap.
The event features screening for different types of cancer, as well as HIV and AIDS and hepatitis checks. Collins John, CRBC News.